But look, I will direct my remarks in relation to CHO7, and I want to acknowledge the opening statement from David and his presence here, and Brendan. I also want to acknowledge David's willingness to engage on an ongoing basis in relation to issues within the area, and that's very much appreciated. I have a few particular queries. I'm going to try and not repeat what Senator Devine, the issues that you have raised, but there may be some small overlap. Just going back to your opening statement and looking at, and again, in terms of the finance, and thank you for the huge level of detail, which was something that certainly when we were speaking with the national team we were looking for, and I did have the opportunity to go into some of it and looking at, obviously, in particular the ratio between pay and non-pay. Obviously you have to have the best of professions, and that absolutely has to be acknowledged, and we have to ensure obviously that there's other elements at play as well, and also just to acknowledge the very difficult job that all of you have, because providing a sustainable and a highly standardised system right across the whole area is very difficult. And of course we're dealing with a society where there's very diverse health and social needs now, and within all our communities and with the communities that you serve also. And particularly in relation to the area of mental health, because we have to look at preventative measures, we have to look at areas where early intervention is needed, areas where intervention is needed, and then acute intervention as well. So there's so many levels, and personally I would put a lot of focus on the whole preventative area in terms of work that can be done with community organisations, with schools, and then helping with the community organisations that do a lot of work as volunteers. For example, I would just mention Hope D, which I'm sure David and Brendan are familiar with, and really do a lot of work in terms of before people reach a crisis point. And the Samaritans as well too, they have their regional base in Newbridge and do a lot of incredible work. And Mojo, of course, is another one, and I've seen it firsthand, the terrific work that they do. Senator Devine has asked questions in relation to the suicide prevention officers. I was particularly interested in just what exactly the work that they do. How do they do their work in terms of suicide prevention? I welcome the fact that funding is being spent on Lakeview unit in Naas. That's absolutely so badly needed, and I'd be interested in a timeline in relation to that. I'm also interested, if you wouldn't mind telling me just about the monthly local forums that have been established, and particularly interested in Area 9. I think the fact that there's views and experience of service users and families in terms of trying to identify the gaps that are there is absolutely hugely important, and help in terms of designing the best delivery systems that you can have. Just speaking to both constituents and friends of mine, I acknowledge, just the whole area of eating disorders is absolutely huge in terms of mental health issues. And I note again that a regional team will be commencing this year. That's certainly to be welcomed, but again, I'd like to know how the rollout of that is going to be, and to make sure that every area is certainly going to have an impact. The home-based treatment team as well. I think it's good to see priorities that are coming up. Just to go back to some of the particular areas that I have a concern about, and CAMS are one of those, and I genuinely regret to say that I don't hear many positive things about CAMS, because I'm always conscious that when we're dealing with professions and dealing with public servants, it's not good for mental health if public representatives start slating them and giving out about them. So I'm genuinely very conscious about that, because I believe everybody has to be respectful of one another. But I have very genuine concerns, and even just to take 3 random samples of constituents of mine and experience that they would have One parent contacted me. Their child is in the system about 10 months now and rarely gets to see somebody and has never seen the same person twice. So there's absolutely no consistency across. That's very wrong. We all know what it's like to have to build up trust with a young person, and the fact that there is a difference between the different professional dealing with the young person over time is not right, and that certainly shouldn't be in the system. I also had somebody that contacted me. Their child who was going to school actually was deemed as too severe for CAMHS, and they were completely caught out. Now luckily that has rectified itself after a number of months, and I spoke with the parent who was desperately trying to do their best for their only child, and when there was such a long waiting list to get an assessment, they said they would pay for a private assessment, and they were told by the CAMHS team that if they went privately for the assessment, they could not come back into the system. So just to raise all of those.
7 minutes. Would you be able to consolidate the questions that you want to put to?
Absolutely. No, I will
Walsh.
indeed. Just very, very briefly then, I would like to see a breakdown of costs re-employing locum and agency staff. In terms, I see where the waiting list for CAMHS I have, and I think we're about average within our own system, but certainly we need to be able to get those better. Does CHO7 ever return funds to HSE? I know it does happen in some places. I think you have outlined your priorities for 2018, if there's any more. And then the last question, you talk about dealing with older people and having a team in place with older people. I am glad to see that the daycare centre in Monasterevin, that there is some improvement on that, because daycare centres really provide such a vital place for older people, and just if we have a timeline on that. Thank you very much, Chair.
Thank you, Deputy. Mr. Walsh, again, concise as possible, please.
And thank you, Deputy. Just in relation to agency, I mean, the total spend last year on agency was €8 million. And within that, 6.3 million euros of that related to adult services, and the rest, or general adult services, the rest was across child and adolescent and psychiatry later life, that's split then between nursing and medical. Now, nursing agency is very high and growing, and it reflects the problem we have in recruiting staff and retaining staff within the service. For example, we've got 184 service development posts since 2012, and we've filled 143 of them, but we only have 34 more staff because we're leaking more staff out the back door, and that's a real issue, and that leads into your other issue around consistency. So if a child or an adult comes back to their next appointment and they don't recognise anyone who's there, then that's a problem. I think in terms of the medical staffing, that has begun to stabilise. It's not completely gone yet, but nursing and allied health professionals, it remains a problem, the high rate of turnover. So in relation to CHO7 giving back money, we generally don't. In fact, I think in 2016 we overspent by in around 3 million, and in 2017, having got a lot more support from the mental health division, I think we came very close to break even, but it was in around 100,000 or 150,000. So, but that reflects the fact that, I mean, we have more than 14% of the population, but we only have 10% of the budget. So, so there's an immediate stressor there within the system, you know. In relation to psychiatry of later life services, I mean, the service in Kildare only started in the last couple of years and is building, and you'll see that in the Vision for Change figures. They are very, very low in psychiatry later life. And the figures across the Tala and St James's sector, who provide the professionals within it provide a very good service, but they're still very much below the bar in terms of the Vision for Change targets. In relation to Monasterevan, well, and I'd broaden it out beyond Monasterevan. I mean, we need to make better use of all of our healthcare facilities beyond merely 9 to 5. I do expect to have a firm design around Monasterevan that I'd be happy to share with you over the next month or so.